Good day, everyone, and welcome to our forum on the humanitarian crisis in Gaza. The region is facing one of the most significant challenges of our time, with over 46,000 Palestinians killed, half of whom are women and children. Today, we aim to shed light on the current situation, its implications, and the path forward. I'm joined by three incredible experts who will provide their perspectives on this pressing issue. Let's meet them. First, we have Dr. Khairul, a public health expert with over 15 years of experience working in conflict zones, including Gaza. Dr. Khairul has contributed to numerous humanitarian missions and research on healthcare in crisis areas. Next, we welcome Razik Ainuddin, an international relations analyst specializing in Middle East politics. Razik has advised on peace building efforts and written extensively about the geopolitical dynamics of the Gaza conflict. Finally, we have Fakrul Ayman, a seasoned journalist and Middle East correspondent who has spent the last decade reporting on the ground in Gaza. Fakrul brings invaluable first-hand insights into the daily lives of those affected by the crisis. Thank you all for joining us. Dr. Cairo, let's start with you. Could you give us an overview of the current public health situation in Gaza?
Right. So first of all, thank you Zakwan for the introduction. It's an honor to be here. So we start with the situation. So the situation is in Gaza, as we know, is heartbreaking. So their hospital are overwhelmed with medical supplies running dangerously low. The blockade has severely limited the import of essential medicines and equipment. So from December 22, 2024 to January 8, 2025, healthcare services managed to reach around 560,000 people, but this is just a fraction of the population dead. The cold winter months have made matters worse, with tragic incidents like infants succumbing to hypothermia due to inadequate shelter and heating. Additionally, we are seeing a rise in waterborne diseases due to a lack of clean water and proper sanitation, further straining the already fragile health system.
Thank you for that detailed overview, Dr. Cairo. Razi, as an expert in international relations, could you share your thoughts on the efforts to resolve this crisis?
Okay, of course, Zakwan, and thank you for having me. Let me start by saying that the Gaza crisis is not just a regional issue, it's a global one. International mediators, including the United States, Qatar, and Egypt, have been tirelessly working to broker a ceasefire. As of today, some progress has been reported, but the talks have yet to yield a definitive agreement. The complexity of the conflict involving long-standing political grievance and security concerns make it extremely challenging to find a resolution that satisfies all parties. However, what the international community must focus on right now is ensuring humanitarian access. This is not just about delivering aid. It's about safeguarding human dignity in the face of unimaginable adversity.
Thank you, Razi. Fakrul, you've spent years reporting on the ground. Could you share what you've witnessed in Gaza and how the current crisis is affecting daily life?
Thank you, Zakwan, and it's a privilege to be a part of this discussion. Having lived and reported from Gaza, I can tell you that the resilience of these people is extraordinary, but their suffering is immense. Over 90% of the population has been displaced, often multiple times. Families are living over crowded shelters without access to clean water, electricity, or sanitation. The destruction of homes and infrastructure has left entire communities struggling to meet their basic needs. Despite this, I've seen remarkable stories of courage. One young mother that I met, Fatima, had lost her home but set up a makeshift classroom in a displacement camp to ensure children in her community could continue their educations. Stories like this that remind us of that's the strength of a human spirit in the face of adversity.
Dr. Khairul, considering the displacement and current living conditions, what are the immediate health risks facing the population?
So, considering the displacement and current living conditions, the immediate health risks are multifaceted. Multifaceted. So, there's a heightened risk of communicable disease due to overcrowded shelters and inadequate sanitation. The malnutrition is a growing concern, especially among children, with reports indicating that 22% catastrophic food insecurity. Mental health issues are also escalating with limited resources available for support.
Razi, what role does international aid play in alleviating these challenges? And what are the obstacles faced?
Okay, that's an excellent question, Dakwan. International aid is a lifeline for the people of Gaza, providing essential like food, water, medical supplies, and shelter. Organizations like the UN and the Red Cross have been working tirelessly to deliver aid under extremely difficult conditions. However, the blockade and ongoing hostiles severely limit the flow of supplies into Gaza. Aid convoys face logistical barriers and security concerns that delay or prevent deliveries. Additionally, the destruction of key infrastructure such as roads and water crossings complicates the situation further. The international community has been calling for an immediate humanitarian access to ensure aid reaches those in need. This is not just a log- logistical issue. It's a normal imperative to uphold the dignity and rights of those affected.
Fakrul, could you share any personal stories that highlight the resilience of Gaza's residents during this crisis?
Absolutely, Zakwan. Despite the overwhelming adversity, the people of Gaza continue to demonstrate incredible resilience. For instance, I recently met a group of young volunteers who organized community kitchens in their neighborhood to feed displaced families. They used whatever limited resources they had to ensure that no one went hungry. Another story that stands out is a local doctor, Dr. Said, who converted his partially damaged home into a makeshift clinic. He treats patients day and night using donated medical supplies. This act of kindness and determination reminds us of the strength of the human spirit. However, the resilience should not overshadow the urgent need for international action. The people of Gaza cannot be left to face these challenges alone.
Thank you for sharing that, Fakrul. As we conclude, I'd like each of you to briefly suggest what steps should be prioritized to address the humanitarian crisis in Gaza. Dr. Khairul?
To address the humanitarian crisis, so I think immediate priority should be given to ensuring access to healthcare services, including the provision of medical supplies and support for healthcare facilities.
Okay, for me, the step is securing a ceasefire and facilitating diplomatic negotiations are crucial to create an environment where humanitarian aid can be effectively delivered.
For my suggestion, I think amplifying the voice of those affected and ensuring accurate reporting can mobilize international support and pressure stakeholders to take meaningful actions.
Thank you all for your valuable insights. The situation in Gaza is indeed complex and heart-wrenching. It is imperative for the international community to come together to alleviate the suffering and work towards a sustainable resolution. To our audience, we encourage you to stay informed and support reputable humanitarian organizations working on the ground. Thank you for joining us today.
Thank you, everyone.